Just got a couple more people joining the meeting. We'll wait till they arrive. Okay, I think most people have arrived now, so we'll continue to let people in as they join. We are recording the meeting, so if we could just share the slides and make a start, please. Welcome everybody. It doesn't seem 2 minutes since we were last here. I hope everyone's well. And without further ado, shall we go through the housekeeping, which is please keep yourselves on mute. And the meeting is being recorded, so feel free to ask questions in the chat box. Next slide, please. And this is a summary of our agenda for today, and we've got Emma Smith and Claire Offer joining us on the call today. So if we could go to the next slide, please. Right, so I think Emma's going to start. Is it Emma or Claire going to start with a verbal update of the case rates, and then we'll move into, so if we could just go back a slide to the agenda, and then we haven't got slides this week for, we haven't got graphs this week, but Emma's going to give us an update, I think, on the local case rates, and then Claire's going to take us through some of the subsequent slides. Is that okay?
I think I was going to ask as a huge favour, Kerry, if we could possibly do it the other way around, because I have to go to Councillor Hepsonstall's briefing at 1 o'clock. So, although it's a slightly odd order, I was wondering if I could do a 5-minute plug on the lateral flow testing site, probably not even that, and then leave you in Emma's really capable hands. Is that okay?
Perfect. Perfect.
Right.
So next slide, please, Sarah.
Okay, so that's the symptom. Hang on. Okay, I'll do testing sites then. So yes, brilliant. Here we go. This is confusing me, so maybe if I just clarify, we have got, if you've got symptoms of COVID-19, so if you've got any symptoms at all, you go through the national system, as we've got NHS.UK coronavirus, you get yourself a PCR test, and we now have the walk-up site at Waterfront. We have the mobile testing units at Featherstone and Minsthorpe, and we are just tomorrow opening another site at the old swimming pool. So that's the route for anybody who's got symptoms, however mild, anybody who's feeling poorly. You go and get yourself a symptomatic test with the PCR tests, which are more sensitive. So that's number one. The other thing that I was hoping I could plug to Community Champions and ask you to promote, if I could have the next slide, please. So this is our lateral flow community testing programme, and this is for people without symptoms, which is all over the slide. Brilliant. So what this is about is it's a regular testing programme for anybody who has to go out of the house for work, for voluntary responsibilities, for caring responsibilities. Basically, if you are a key worker or a key volunteer, or you have to look after somebody vulnerable, and that means that you can't stay at home during lockdown, then what we would like to encourage people to do is to get a lateral flow test twice a week. And at the moment, that's at one of our community testing sites. I don't know, I think I'm able to put a slide up, just a minute. Yeah, here we go. Oh, no, we don't. Okay.
There we go, Claire.
Right, that's working, isn't it? Yeah. Okay, so that I've said what it is. A lot of people you will know are being covered by national schemes, so NHS, teachers, social care, some workplaces. But for anybody who hasn't got that available, a community testing site is your alternative. And what I was wanting to plug is that we now have a site open at Wakefield College 7 days a week, where anybody can book to get a test. Obviously, we know that travelling to central Wakefield is not a sensible option for a lot of people. So probably the last week in February, we're going to be opening hubs at Castleford and Kinsley. We can't offer self-testing at home yet. We know people really, really want that. And obviously some people like the NHS and primary teachers are getting it. But it's only been approved as part of a national pilot for specific groups. So watch this space, because it's something we might well be able to offer in the near future. But at the moment, it's not something that people can do. And this is the plug. We've opened our first site at Wakefield College. That's the link for people to book. And I can give you this slide, Kerry, if needs be. When we've got Cass and Kinsley, those sites will appear. We've got it on Twitter. Please, businesses picking up, but fairly slowly. So please do put the word out for anybody who would like to do this. And if as community champions, you've got specific questions, that's our kind of single point of contact email address. So there we go, stop sharing. That's my very brief plug for community testing. Is there any burning questions anyone wants to ask, or shall I just leave you with Emma?
There's a question in the chat bar, Claire. Is it advisable for key workers to get regular lateral flow tests, even if they've had a vaccine, their first vaccine?
Yes, correct me if I'm wrong, Emma, but I think our issue is that although we think the vaccine will protect you from getting severely ill, what we don't know yet is what impact it has on you becoming infected and transmitting to somebody else. So actually, it would be really useful for people who've been vaccinated to continue to have regular testing. Have I got that right, Emma? You're nodding.
Spot on, Claire. Thank you.
Excellent. Right. Shall I leave you with these lovely people then?
Thank you, Claire.
Okay. Oh, do you have to? Oh, hang on. Very quick answer to that. We would strongly recommend twice a week. If you really can't manage twice a week for whatever reason, then it's worth giving once a week a go. But the risk becomes much higher that actually it won't be effective and we'll miss picking up an infection. So twice a week if you possibly can is what I'd say. Once a week if you can't. Okay, so I'll bob off now, Emma. Thank you.
Thank you, Claire. Hi everyone. I'm just a bit conscious of time, so I'm going to whistle stop through some of the information so we can have a bit more time on the later presentations from colleagues around the local contact tracing service. So I haven't got any slides around the data today, other than to say it continues to be an improvement picture for Wakefield in terms of case, but the level of improvement is slow. So we're not seeing that rapid decline as we had done in previous lockdowns or tier experiences. And I know Anna's shared that before, and a similar improving picture, the number of people that sadly passed away for the district as well, and similar for the number of people in our hospital with COVID is continuing to decrease. So continues to be improving picture, but we still need to do more. So next slide, please. So I think the next slide is around vaccination. So I'll talk while we get our technicalities going for the presentation. So I think for me, it's a couple of key messages around the vaccination. And one really positive one is that the majority of all the Wakefield residents who are over 70 years of age will have had their vaccine offer by the end of this week, which is really, really positive. And you'll understand now that nationally the message is around asking people who are over the age of 70 to contact the NHS to request their vaccination, and that message has changed because previously it was saying the NHS will contact you. So that's really important that we try and promote that over 70-year-old message that you can now contact the NHS if you haven't had your vaccine already. It's really important that everyone has their vaccine when they are invited forward for their vaccination. And we would ask residents that they don't wait for any particular type of vaccine, because it's really important that we don't delay that vaccination experience and that offer the vaccination, because with the vaccination you are protected against the severity of illness and your risk of dying as part of contracting the virus. So we'd really like to encourage everyone to continue to come forward for their vaccination on that basis. In the coming weeks, we are going to see the age cohorts being extended. So here we see the JCVI cohort. So in the next week or so, we are going to see people in the 65 years and plus category start to be invited through the national booking process and through the GP invitation process. The other thing we would really like people to prepare for, if you are a carer or you know people that are carers, we were really liking people to come forward and register with their GP as a carer, and that is paid carers or unpaid carers, and that helps us prepare for the invitation process and the rollout of the vaccination programme, particularly to carers which are in group 6 of the JCVI criteria, which is similar to those in the 16 to 64 years with underlying health conditions. So I think they're my key messages today, and we'll be able to take any questions.
Any questions on vaccinations for Emma?
So there's one question about the Oxford vaccine and the effectiveness in the elderly. I think from a UK perspective, we still think it is effective vaccination for the elderly. And again, it offers that protection from illness and death. I think we're obviously going to look at the evidence that's coming forward from other areas around sort of if it's less effective for the elderly population. But from a UK perspective, we believe it's too early to make that judgment call at this point in time. And if it transpires that that is the case, then we will be offering other vaccination opportunities or booster opportunities. And people will be aware of the messages in the media as well around new variants and the effective vaccine there. We're still confident that the vaccine is effective against the variants that we're aware of presently. And as being promoted nationally, if that changes, we will change our vaccination strategy to match that as part of the national messages. Trying to think, lateral flow, there was just one question on lateral flow, wasn't there? How long does the process take? I think it's like a 15-minute process. It doesn't take very long in terms of the lateral flow testing. And can lateral flows is it the lateral flow presentation be emailed to attendees? I'm sure it can do following the meeting. So I will pick up these questions as well. So in terms of sort of vaccination opportunities locally, from a Wakefield perspective, we really try to adhere to the national guidance as close as we can in offering vaccinations, and that ensures that we're focusing the vaccination programme where it's most valuable at this present time. And it's a matter of time for people to be invited forward. In terms of a volunteer testing positive and not yet being contacted by the contact tracing service, I'm really sorry, colleagues, and would we mind just going on mute? There's a bit of background noise. I'm just conscious that people may struggle to hear. Thank you. So in terms of volunteers testing, but anyone that tests positive, their positive test result goes into the national system, and that triggers an NHS test and trace call. The person will first get an online form to fill out, and if they weren't able to complete that, then they would enter into a call system. I'm going to let my local contact tracing service tell you a bit more about the service, so they'll pick up that aspect. In terms about can we return to normal, do we need to close the building? If this is a volunteer working in a volunteer service, then you as a service who are supporting those volunteers, you need to identify anyone within that volunteer service that may be a direct contact as per the national guidance. And that's within 15 meters for 15 minutes and longer. There's a lot of guidance around that. And then if you have identified those contacts, then they are required to self-isolate because they're a contact of a positive case. And also the volunteer may be able to put their details into the test and trace system as well, so they get a follow-up as part of that process. In terms of closing the building, I think that depends when they were in a building and when they were infectious. So if they're in the building today and they test positive tomorrow, then they were in that building whilst they're infectious. So you need to undertake a deep cleaning process or cleaning that building because they were present there, and surfaces, etc. But there's all very clear national guidance around that. I'm going to pause there, Kerry, if that's okay. I think we'll let our other speakers speak and then we can take any questions at the end. Is that okay?
Yeah, that's perfect. Thank you. So we've talked quite a lot in recent weeks about vaccinations, which is around primarily at this stage mitigating the effects of COVID on people, preventing them from becoming seriously ill. But we still need to make sure that the test and trace service is really in the forefront of our mind as well, because that's the bit of this process that stops further transmission. So for that reason, we've invited our local test and trace service, which has been up and running for a few months now, to come and explain a little bit more about what they do and to also answer some of your questions. So if I can introduce Laura and Debbie and hand over to you, please. You're very welcome to go ahead.
Okay, thanks very much. I'm Debbie Yildirim. I'm one of the managers for the local contact tracing service, which covers Wakefield and Kirklees. Next slide, please. So just as an overview of the service, as I said, it covers both councils and is for residents of both areas. So the service is working alongside the national NHS test and trace to make sure we trace the contacts of everyone who test positive for coronavirus as quickly as possible. And this will help stop the spread of COVID-19 in local communities. Next slide, please. So evidence from other areas suggests that local people contacting local residents is a lot more effective than the national test and trace service, and we're certainly finding that's the case in Wakefield. If the national test and trace service is unable to reach people who test positive in Wakefield and Kirklees quickly, then their details are passed to us at the local contact tracing service and we get in touch with them. So local contact tracers will try to directly contact people to provide advice and support and to gather details of their close contacts. They can also advise people who have tested positive and their contacts about how to get practical support if it's difficult for them to self-isolate. Next slide, please. So the team itself consists of 2 service managers, so that's myself and Laura. We have 6 senior contact tracers and 10 contact tracers and 4 data information officers. All the staff, whether full-time or part-time, live and work in Yorkshire. And within the team, we have a retired GP, a retired practice nurse, a retired health visitor, a paramedic, and a variety of other professions. So we do have quite a broad range of skills within the team. We've got 4 members of staff also who have worked for the National Test and Trace Scheme. Next slide, please. So what exactly do we do? So if NHS Test and Trace, that's the national team, has been unable to contact you within 24 hours, then your details are passed to Wakefield and Kirklees local contact tracing service. And we will then contact you by phone or text initially. If it's somebody under 18, we'll ask for a parent, carer or adult family member for the call to continue. And calls will come from the local 01924 number. If we can't contact you, someone may at some point go to your home to speak to you, but that part of the service isn't up and running at this stage. We won't ask for any bank details or payments. We won't ask for details of accounts, social media or anything else. For you to set up a password or PIN number over the phone, nothing like that. We do get some people who are a bit concerned that we aren't a real service and that we're a scam. So, you know, we just want to reassure people that if it's coming from that number that's there, then it is us. And you can always call us back if you have got concerns. So we'll ask for your name, date of birth and postcode, who you live with, any places you've been recently, names and contact details of anyone you were in close contact with within 48 hours before your symptoms started. And how we actually use that information is anyone you've been in close contact with during the infectious period will be told to stay at home and self-isolate. And this information, the information you give to Wakefield and Kirklees service will be handled securely in accordance with data protection law. Next slide, please. So I'm going to hand over to Laura now, who's going to go through what the contact tracing form looks like.
Hi everyone, so my name's Laura. I'm the other service manager for the local contact tracing service. So I know that if you haven't tested positive, you won't have seen the form. So I just wanted to talk through how the actual contact tracing form looks and the type of information that we use and how it is then put onto the system. So each question that we ask has its own specific section, and we will only fill it in if it's actually relevant to the contact tracing. So for example, if you work from home and you haven't actually been to work, then we don't need to take that information. We do keep it completely relevant to you know, actual contact tracing. Next slide, please. So one of the main components of the contact tracing is to you know, discover household contacts. So that's just the form there. So you can see we ask for first name and last name of your household contact. We would ask for their date of birth. That's important to kind of try and discover how we would then contact them in future, because it's obviously it's not appropriate for somebody that's under 18 to receive isolation texts. You know, an adult should be responsible for that information. And then we also ask for their email and phone number so we can then get in contact with them. So there's a couple of different ways that Test and Trace would get in contact with your contacts. So one way would be if one member of the household kind of decides that I'll take responsibility for everybody within the household. So that would mean that you would then be asked for a phone number for your household contacts, and they would then receive a self-isolation text message with their isolation dates. It would also have a unique account number that would be used for the self-isolation payments to be able to apply for that, because you need your account ID to do that. So the text message would provide that. Obviously, if you don't want to take responsibility for people within your household, you absolutely don't have to do that. And then we would take a phone number for them, and somebody within National Test and Trace would then call your household contact. So there's just a couple of different options that we could go for, because we know they were getting feedback that household contacts were kind of receiving too many calls. So this is just a little workaround to that. So there's a couple of different ways that Test and Trace would get in contact with the contacts to inform them of their legal duty to self-isolate. Next slide, please. Another part of the form would be to try and find out about your activities. So that would be anything like going shopping, going to a place of worship, any sporting events. Just, you know, there's a lot of information there. You know, it can either be, you know, like exercise classes. So a wide variety of activities are covered there. But if you don't participate in any of the activities, we just skip through that. I know this can be a concern for some people, but, you know, we would just like to reiterate that, you know, we won't ask any questions at all about how you're paid at work or your immigration status. We're purely there just to provide support and to stop the spread of coronavirus. Next slide, please. And yeah, just have you got any questions regarding the service? Check the chat.
I don't think there are any questions.
I suppose the most obvious one is if you're identified, how do you monitor that the person does stay at home?
Okay.
That's a tough one. We do, you know, rely on information regarding that. I know sometimes we, you know, during the isolation calls that National make, it can become apparent that maybe they are out and about, and then that information is then fed back. But that's something that the National Service deal with at the moment. So we wouldn't really be involved in kind of enforcing the self-isolation for contacts. That is something that then goes back to the national level.
I think I would just add in there as well, I think nationally the picture is really positive that we know the vast majority of people do comply to the self-isolation guidance, which is really encouraging, but we do know there are occasions where they don't, and if there are occasions where Wakefield residents aren't, and we have the means to support them to isolate, because there's about understanding the barriers and implications of why someone might not be, and trying to support people in that way. So the financial payment is one aspect of that. So where we are aware, we do try and support people to enter back into isolation.
And to add to that, we do have a specialist and enhanced support service for people who, because they might have particular vulnerabilities, might really struggle. So we do have staff in one of our VCS organisations who can provide practical support and emotional support if people have got vulnerabilities that make it difficult for them to do that. So if that is the case, we would encourage people to get in touch with us, and we can put them in touch with that support service. Obviously, that is different to if people choose not to, but if there's a, you know, the vulnerability reason for any reason why people might struggle, we do have that support service available. We've got a couple of other questions. Sorry, go on.
Yeah, I was just going to answer the question regarding interpreters. So yes, we do have access to an interpretation service called Language Line. Occasionally records will come through to us from National that specify that we need an interpreter. So we already have that information, but yes, we do offer an interpretation service.
And there's another call about phone call or internet, and I think you've answered that.
Yeah, I can go through it again if you want me to, Debbie.
Yes, fine, Emma. Sorry, not Emma, Laura.
Yeah, so how the contact tracing works is that when you test positive, your details get entered onto the national system. You'll also then get a series of text messages that are inviting you to fill in the form online. So you get 8 hours to fill in that form online yourself. If you haven't filled in the form, that's when the record is then triggered to send to National. So your record will then go to the National Service, where it'll sit for 24 hours, where National will attempt to make phone calls. And then it's at that point, if they don't get through, then it comes through to us. So that's kind of the pathway that the records follow. So you do have both options. You can fill it in online, but like I said, there is just that time limit on it.
Thank you. That's really helpful. And if anybody's got any other questions, please put them in the chat or contact us afterwards. But I think if that's okay, I'd just like to thank Debbie and Laura for that presentation. Really good to hear from you and to meet you. And then we'll just finish up quickly with a few more slides. So if we could just move to the next slide, please, Sarah. And just to remind people to make sure that they're only sharing trusted information, and Niamh is going to so yeah, and on that note, if we could move to the next slide, and Niamh will talk us through the Do It For campaign just briefly.
Yes, hello everybody. So this is just a communications campaign that we're running at the moment. I think I might have mentioned it to a few of you before, but it's just to urge residents to follow the rules at the minute, obviously with the ongoing restrictions, and to do it for their loved ones, critical workers and the NHS. So what we're doing is involving frontline critical workers and staff for Wakefield Council to highlight, you know, the frontline workers who have been really important during the pandemic efforts. So if anybody is a critical worker or knows anyone who is and would like to get involved, we can include them in the campaign with their name, picture and how they've helped the COVID efforts, just to prompt people just to carry on. We know it's difficult, but to carry on following the rules for those people. And my email address is on there if anybody wants to get in touch and be involved, or nominate anybody to highlight the great work that they've been doing. So yeah, thank you.
Thanks, Niamh.
Okay.
And then just a couple more slides to finish off. The next slide just reminds us about the census. We did have a talk last week about the census, but just to keep that in everybody's minds, the census is the data that we use to plan public services for the next 10 years. So it's really important that people who might otherwise be missed out due to vulnerability are included, so that we can plan our services for those people over the next 10 years. So I'm not going to talk any more about that, but please just keep that in your minds over the coming weeks. And then the next slide, please. So we are introducing a code of conduct for COVID community champions. This is not based on anything local, but this is based on national feedback, because we're not the only COVID community champion scheme. And we just wanted to reiterate, as we're still recruiting and getting lots more people joining the scheme at the moment, especially around the interest for vaccinations, that we're just asking people to consider the 3 main points. So if we could move on to the next slide, please. So we ask you, and I hope everybody on the call will agree that these are reasonable, to check information, that make sure it comes from a reputable source before you share it, and if in doubt, please check with us. When sharing messages, it's really easy to get sidetracked when you're in a discussion, and we definitely want people to have discussions, but please focus on the message and the spirit of the message, rather than kind of getting sidetracked into other people's personal views or even your own. I hope that makes sense. And the other thing is that please don't apply your own interpretation of the guidelines. Please ask us for clarification and signposting. That's what we're here for. We're here to help give that information out, make sure it's clear, and if it's not clear, we absolutely want to know about that, so we can help with that messaging. And to that purpose, we are hoping to have an additional session that will give which all community champions will be invited to, which just gives a little bit more in-depth information around how you can deal with some of those challenging conversations and how you can answer those questions, making sure that we stick to the messages. So I think that's definitely on the back of some of the misinformation that we've seen circulating. So we're hopeful that everybody thinks that they're reasonable. If you've got any comments, please kind of get in touch with us, but that's something that we'll just be introducing to our standard kind of communications going forwards. Could we move on to the next slide, please? Yeah, that's just our final slide. We've got a lovely new email address, COVID Community Champion, so ccc@wakefield.gov.uk if you want to share that for any messaging you need. Tracy, Sarah and I have all got access to that email box. Please join our WhatsApp group. There's lots of information coming around about vaccinations that's in other formats, lots of videos and audio and things like that. So please continue to invite people, because we know there's lots of discussion. And I just want to thank people for their time. Have we got any quick questions? Yeah, so Library Service would like us to remind you that they are supporting census completion. So we'll make sure, Catherine, that we include that information going forward. And when will volunteer services get their vaccinations, especially with help at the Hub project? Emma, do you want to just briefly answer that one?
Yeah. So under the social care guidance for vaccination, volunteers are being included where they're sort of providing frontline care and support, and physically seeing individuals who are elderly or clinically vulnerable, or where children are extremely clinical vulnerable. I think in terms of there's some great volunteer services doing tremendous work there, and I think it's just a case of matter of waiting in terms of when your age group or age band is open to invitation if you fall outside of that eligibility criteria at present. So I think it's just a matter of waiting. There is no blanket response to when all volunteer services will come forward. So certain volunteer services have already been asked to come forward because of the nature of their volunteering experience. For instance, volunteers within a hospice environment, if that's still happening, volunteers within a hospital environment, if that's still happening. So I think at the moment it's a case by case basis depending on your service and whether you fit the current definition under the social care guidance.
And just to follow on from that, that is absolutely to do with the nature of the role and not how the roles are valued, because we know that there are a huge amount of people doing very, very important key work that is part of this enormous Wakefield district whole partnership response. So it's not absolutely to do with the value and the importance of your role, it's to do with the nature of the role and how that fits into the JCVI criteria.
Totally agree, Kerry. Totally agree with that.
Okay, so we've gone a little bit over time again. It's so hard to fit things in half an hour. Just want to thank everybody for their time. We've got no online sessions next week. So we will see you again in 2 weeks' time for COVID Community Champions. In the meantime, please use the ccc@wakefield.gov.uk email address if you've got any questions or you want to get in touch with us about anything. And thanks very much for your time, everybody.
Thank you, everyone.
Thanks. If the presenters want to stay on for a couple of minutes, you're welcome to do that.